group, Dan Monroe and Joe Flower, up to the stage, and I'm going to introduce while we're talking. So Dan Monroe, while has become a good friend, is a contributor at Forbes magazine. Now, as you guys know, I rarely read long bios. They're all printed in your books. So I've asked for fun facts or stories from each of our moderators. So, and he'll take care of introducing Joe. So Dan is a avid geek and a golf nut that once had 6 sets of gloves and and played once with a PGA pro. His favorite shopping is Fry's Electronics. I didn't even know they still existed. That's awesome. And PGA Tour Superstore. Fortunately, Phoenix has 2 of them. I'm sure they're thrilled to have you. Thank you.
Thanks, Jill, and congratulations on the new figure. That's awesome. Congratulations.
Yes.
And for anybody who hasn't been to the January event at CES, this is kind of like a teaser in a lot of ways for that event, because that's the main event. And I've always been a big fan of what Jill's done in the sense of putting a healthcare conference at CES. The foresight there was pretty amazing. So I wanted to get started pretty quickly with Joe in the sense of, Joe, you've been at this for a long time. Give us a sense of your background.
A little while. I've been writing about healthcare for 35 years. My first article about digital healthcare was in 1985. I see people in the room that weren't born yet. My first articles about population health, which is this year's buzzword, was in 1990. I've been doing this a long time, long enough to have lost substantial money in the dot-com bubble of the 1990s on a digital health company. So I've been where you're sitting. And I know that many of the things that are going through healthcare management and digital health entrepreneurship are wrong. They're based on false pretenses, false assumptions about healthcare, and that's what we're going to talk about the next half hour.
So let me get right into it. Earlier this week, the Commonwealth Fund released a study that suggested America is dead last out of 11 countries.
They always are.
Relative to healthcare. So on the one hand, we're dead last. On the other hand, is an amazing quote from Jonathan Bush, who's the CEO of Athena Health. The healthcare economy, by contrast, is a jungle dripping with low-hanging fruit. The opportunities are limitless, and the market is immense. For digital entrepreneurs, it's almost like getting a chance to return to 1998. So the first thing they should do
I'm not sure I want to return to 1998.
So the first thing they should do after the requisite due diligence is to jump in.
Yeah. I'll tell you where those two come together.
Okay.
There is a huge opportunity in making healthcare work better in the United States. The fact that we come in dead last year after year after year in the Commonwealth funds, they're looking at all the big economies that we would not be uncomfortable getting sick in Germany or France or Canada or someplace like that. The attempt is to close that gap, is to make healthcare in the U.S. not only far better than it is, but way, way cheaper. My last book was called Healthcare Beyond Reform. I'm doing it right for half the cost, and I think that's a conservative estimate. We could probably do it for a third of what we do it now. So the place to look in these opportunities is not what looks cool to you, what looks like a neat gadget, a neat app. That's not the place to look. The place to look, people are running healthcare organizations now. They're reorganizing like crazy. And what they're trying to do, there are these new economic models of various kinds that put them in the financial position of doing better, making more money, if they can actually manage the health of populations, help people be healthier. This is something we have talked about, well, like I've been writing about it since 1990, and they have never really done it. Almost nobody out there has experience in this. These business models are prototypes all the way down. And they don't know exactly how they're going to do this. So if you look at that gap, and you say, what kind of apps, dongles, gadgets could help close that gap, help them manage the health of populations, especially those 5%, those 1% that use the majority of the healthcare dollar. 5% of the people in any population use half of the healthcare resources. And how do they connect better with them? That's where the low-hanging fruit are.
So in the course of a short month here, we've had major consumer health announcements, if they're health, fitness more or less. Apple, Samsung, Google is expected to announce Google Fit next week at I/O here in San Francisco. We're about a 6-iron from their San Francisco headquarters.
6.
But Microsoft and Google have already had an experience sort of on the consumer side of this. Google Health shut down, and Microsoft has Health Vault, but my understanding of the revenue model there is really more broadly based on countries outside of the United States. They don't make money really on the product here in the U.S. So is this better timing for engaging consumers in healthcare activities with these big announcements from companies?
Microsoft has also been very active in, Google maybe as well, but I'm aware of Microsoft, in hot housing various ideas and dongles and apps and stuff for years. I remember the first time I took a sonogram of my heart. I was at a little conference like this, and my fellow speaker handed me it was before smartphones, handed me a little cell phone that had a screen and said, here, stick this in. It was pretty amazing. The other countries, especially the poorer countries, are leapfrogging us in terms of cell phone use, smartphone use, and digital health to manage the health of populations, because it is way cheaper, and you can have one cell phone for a village that does the job. I think that's a tremendous opportunity out across the world. And again, it is doing actual medicine. The fitness stuff, it's interesting, but the market for there are the kinds of people like you and me who might already count our footsteps with a pedometer, or might already be counting how much carbs we're eating. We are a rounding error in the mass market. That is not the mass market. The mass market, the huge market, is the people who want a better connection to clinicians.
Any issue that you see relative to these large consumer-facing companies, Apple, Samsung, Google, Amazon maybe, at some point?
With our information?
Right.
Yeah. Well, on the fitness side, you have to divide it in two. The fitness, the measured self. We got the same problems there as we do with all the other transactions we do with Facebook and Yahoo and Google and everybody. We have the same privacy problems there. The medical side, if you're actually using this to interface with your clinician, that's covered by HIPAA laws, which are actually health something Privacy and Portability Act. Anyway, HIPAA. If you're not familiar with it, got to look it up, because it really mandates privacy, and actually more than most clinicians think is necessary, but mandates a lot of privacy and accountability for who accesses that record, who changes that record. And this is going to, it doesn't matter if Google's doing it or Apple's doing it. The app has to do that.
Second issue on the same point, because I did a 5-part series in March on healthcare interoperability. Is there an issue relative to having this data in different silos? Apple is a silo, Google is a silo, Amazon is a silo. Is there a similar challenge in the sense of interoperability of this data?
Yes, I don't have any inside information as to what sort of standards they're following. Maybe people here know this better on the technical side. There do exist coding standards for how you code medical information. Most of the legacy players in healthcare do not follow them. So for instance, Kaiser built this enormously wonderful, they really did a good job, spent $4 billion building out their their system built on something by Epic. When you talk to somebody, and it's very useful within Kaiser, you know. I go to my Kaiser doc, she has my total record there of everything I've ever done with Kaiser back to when I was born. And in the course of 25 minutes can work through everything on the list. It's pretty amazing. But if you were a doctor for someone else, and you suppose you're a specialist, a pediatric specialist at some children's hospital, and a child comes in referred to you because you're a real quaternary, you're the end of the line, and they're a Kaiser patient. What you get is a long, disorganized, physical paper printout of their record that you have to page through, and it's even harder than paging through an old-style written medical record because it's not organized for a human to read it. This is rife across healthcare. It is a crime. The people who do these things, who make programs in healthcare that do not allow you to take your medical records from one place to another, should be taken out and shot, and then their bodies hung from the Bay Bridge.
Wow.
I don't really have a strong opinion on this, but it's, you know, because literally it kills people.
Yeah.
And makes people suffer and costs us huge amounts because they decide that for their proprietary purposes, they're not going to have they're not going to have the facts of your medical life transportable with you. Do not do this or I will hunt you down personally.
2 years ago, Ernst & Young wrote a report that suggested, it was a provocative quote at the time, and it still resonates because they said, in effect, if you're in the healthcare business, you're in the behavior change business. And there's companies that have tried to demonstrate this. I think the first one was Massive Health. But is
What a wonderful name. Massive Health.
Massive Health. So were they too soon? Are they too soon in the sense of trying to engage consumers relative to persuading behavior, to actually trying to modify behavior? Here's another statistic. The Wall Street Journal, I think 2 weeks ago, highlighted the fact that 41% of high school teenagers acknowledge that in the last 30 days, they have texted or emailed while driving. So this technology has tremendous capacity and potential, but how do we modify the behavior in a way that says there are sort of rules of the road to this? Is there a way to do
Right.
that?
5% of any population drives 50% of the healthcare use. 1% drives 20%. Now, some of those people just got pancreatic cancer. Some of them just got hit by a bus. Next year, they will be better or they won't be with us. So, okay, we spent a lot of money on them. A good proportion of those people are in the same category month after month and year after year. They didn't just get hit by a bus. They have chronic, unaddressed chronic problems that bring them repeatedly into the ER, into the surgical suite. There is where we drive down the cost of healthcare. And that is, a lot of it is behavior change. Getting them to understand their diabetes, getting them to be on their high blood pressure medicine, keeping them connected to the system so that they feel like they've got a partner in the system. Now let me ask you this. All of us in this room have one or the other behavior problem, whether it's drinking too much or using the wrong drugs or buying them from the wrong person or whatever, or not exercising enough. I rode my bike up this hill from the Ferry building, and it's reminded me how little I've done that lately. We all have a behavior problem. If somebody calls you up from the insurance company and reads you a script over your phone, are you going to change your life? Give me a break. And that is what, you can find papers out there saying that population health management, that disease management does not work. But when you drill down through the papers, you see what programs were they looking at where they were on which they're saying this. They're talking about people, strangers calling you up and trying to change your behavior over the phone. Not going to work. Texting you something on your wrist digital thing is not going to work. Here is the most efficient idea in healthcare, and it is one that is massively not understood through the industry of healthcare, and that is trust. If you're a technical person here, you know what it means for one system to trust another, right? It means you take the information directly, and there's no firewall, there's no filter. You take the information directly from the trusted system. Where do we get the information on which we change our lives? We don't get it from a stranger. We don't get it from someone reading a script. We get it from someone that we trust because they have the right letters after their name. They seem to know what they're talking about. RN, NP, DO, MD, PA. Maybe because they're wearing a white coat, have a stethoscope, maybe. They have some signs of office. Someone who is working for the right people. So no, nobody from the insurance company. Somebody who's working for the right people, who seems to have your interest at heart, has the right letters after their name, and with whom you have built a personal relationship. That's trust. That sounds like it costs a lot of money, but it's not, because it's highly efficient, because it actually does make behaviors change. Now, you can mediate that. Once you've established the relationship, you can mediate that and keep it constant through apps, dongles, gadgets. Very effective. Not been tried much. None of this has come to fruition at the mass level. This is what is being attempted in various ways all across healthcare. These next 3 years are going to be amazing. There's prototypes all the way down. All of these new ACOs, these different ways they are trying to manage this, they're all prototypes. And we know that prototypes, you don't expect them to work. You build a prototype to see how it doesn't work, so you can see what you might build next. And maybe on the third iteration, you'll get the model right. This is what they're doing. Your job is to help them find that way that they can keep direct, trusted contact with the people they're trying to change their behavior. That's the job of digital health in this new model.
So that's a great lead into the next question, which is today, most of healthcare is fragmented and episodic.
Yeah.
There's a role in there for digital health to help us move to more team-based coordinated care. How do we do that?
Yeah. When you try to track down, one of the questions I ask, I'm writing a new book, a how-to book, should be out in September, called A Handbook for the Revolutionary, Changing Healthcare Overnight. What do you really do to shift the hideous place we are? And a piece of that is how do you deal with the health of populations? Every place you look, and there are different programs and such that I highlight, every place you look that has worked, it breaks the traditional just one person going to see one doctor model. It breaks that. It breaks it in favor of a team of people, a panel of clinicians and psychological people and sometimes dentists and pharmacists, a panel of people working together over time as a team. Now, we know from manufacturing, we know from surgery, we know from ERs and such, that teams of people become highly efficient over time as they learn from each other. This is the model that is going to have to come into play and is increasingly beginning to be put together in some in hospital-based organizations, even more, though, in multi-specialty physician organizations, the physician-based organizations, because the physicians drive the behavior there, and they're learning they need to do it in teams. So I think that experience is going to make the team model much stronger. It's going to come to the fore. And as part of that, they're going to be desperate for what's the physical model? How do we interact with our patients? And there is the opportunity, because they're going to be desperate for ways they can have a fiercer, deeper, more constant interaction with their panel of patients that they are responsible for, which might be several thousand. How do they have that over time for way less money? Because they're not getting paid on volume anymore. The rubric in the business is volume to value. They're not getting, many of these economic models, they don't get paid more to do more. They get paid more to do better. And they make more money if they actually do less by doing better medicine. That's the opportunity.
So Vinod Khosla made a provocative statement at a conference. I think it was last year or maybe the year before, but it's still out there, and it's still as provocative today as it was then. He said 80% of doctors could be replaced by software. Is he right?
I think the operative word there is could be. And I remember that quote. He goes on to express the fact that he would trust the software more than the average doctor. And what's really important here to note, I mean, I kind of agree with that. You know, I have my Kaiser doc, but I also balance it against a sort of new age, doesn't exactly use crystals, but one of those Mill Valley doctors. And I balance that against this naturopath we see in Boulder and this guy out in the desert in Baja. I'm serious. we have lots of places we look for opinions and online. But Vinod Khosla's opinion about this does not matter. My opinion about this does not matter. Your opinion about this does not matter, because we are all smart, educated people who are willing to take charge of our own health and manage our own health. We are a rounding error in the market, as I mentioned. We are not the customer. Smug digerati, like you and me, are not the customer here. The customer is the average person out there who is put in the spot of being a caregiver for themselves, for their children, young mothers with kids who really, you get scared when your kid's temperature goes over 105, or people taking care of their parents, aging people taking care of each other, their spouse. That's the market. That's the market. And they're going to look for lots of information. They are not going to give up on the trusted clinician. And what matters for the future of those clinicians is not, are they average or better or worse than average? What matters is, are they doing something that really helps the health of people, or are they doing, like, back surgeons doing complex back fusion surgery for simple back pain? Their whole business model is based on that, and it is not even medically indicated. It doesn't help. If you're that kind of clinician, you're going to face a tough future in this volume to value world. If you are the kind of clinician that is connecting with patients, especially at the primary level, and you're part of these teams, and you're using the digital healthcare to move you forward, it's a very bright future. There's a lot going for you, and we're not going to have to worry that millions of people are going to be like Vinod Khosla and say, I'll just read the software and do it all myself.
If there's an association with digital health, a lot of times it comes up as fitness and wellness.
Yeah.
Telemedicine, on the other hand, has more of a clinical overview. Is that a branding problem in the sense of putting those two together, or should they be distinctly separate?
I don't know. These new platforms that are being brought out by Apple and Google and such, they seem to try to elide the line between those two and say you could use this to connect with your doctor or that kind of thing. I'm not certain. I don't know the technical what they're doing in there. Like I said before, the medical side of it needs to be HIPAA compliant. There's a lot of regulation, and there's a lot that has to be encoded into it so that it can do that. I think it can be a branding problem. The thing is that telemedicine part of it, where if you ever seen Dr. Eric Topol speak, where he'll do a sonogram of himself. He opens his shirt on stage, and there's his heart up on the screen because he's got a little dongle attached to his iPhone, and he's got some wonderful videos online. And what he says is, I prescribe more apps than drugs these days. The introduction to the telemedicine side of this is much more likely to be from the medical system that someone is a part of, where their doctor will say, do you got an iPhone? What do you got? Okay, here's this app that we can follow your high blood pressure or whatever. Here's how you do it. It's going to come from the medical side of things. So if you're out there trying to sell an app, a dongle, gadget of some kind, a sensor, your real market on the telemedicine side are these multi-specialty medical groups. They're the large healthcare systems who are trying to drive especially primary care. And so you need to figure out what their problem is. What problem are they trying to solve in terms of connecting with their customers and helping drive behavior change, helping solve the population health dilemma. That's your market. So I don't know if it's a branding problem. It's a different market.
Different market. So Jill alluded to a debate yesterday on FDA regulation, and I know the FTC is stepping in, or at least in joint conversations with the FDA, which makes some sense because some of these apps, some of these devices are making promises, consumer promises, that may overstep one or the other bounds.
Like Dr. Oz type promises.
May overstep the FTC, may overstep the FDA. There's a debate there, and I know that there was some speculation that Apple is actually in discussions with the FDA.
Yeah.
Is it likely that we'll see these big companies, Apple, Samsung, Google, engage the FDA for devices that are more clinically oriented?
I'm sure they will. And many of these already have undergone FDA scrutiny. But we are in a better place than we were in the early, mid-1990s when we were first trying to do this, and in which we were madly trying to inflate companies so that they could take all our money and flush it down the drain. But one of the things we discovered then was there was a point at which the FDA came out and said, okay, medical software, all medical software, even if it's on some device that you own as a consumer, is a device. The FDA does testing for medical devices. You have to go through a whole thing and get certified. It does it in 7 different regions, or at least it did back then. So you have to get certified 7 times. And they said, not only is the software a medical device, every iteration of the software is a medical device that has to get recertified. And you're like, wait a minute. If you've ever done anything with software, what you know is that it gets iterated like every month or so. So this essentially was telling the whole medical software industry that they could not exist. They worked through that problem. They're smarter about it now. I think there will be, and I think there should be, some interaction with the FDA, especially on the telemedicine side. And it does have to be HIPAA compliant. There's a lot of regulation around it. And if people designing these do not understand the regulatory atmosphere, well, they need to get up on that, and they need to expect it. And they need to not have, there tends to be a Silicon Valley feeling that we could just sort of blast through all this, and we could design these new business models, and the world will just get out of our way, and it's not going to.
So I did want to save 5 minutes for audience questions, so feel free to be thinking about those. I did want to follow up on a comment that John Scully made at Digital Health Summit in Vegas, I think it was 2 years ago, when he said, he basically asked the question, where is the iconic healthcare company? Do we have one yet? Is that on the road? Is there a future in the sense of somebody filling the shoes of becoming an iconic healthcare company?
No. Well, whenever people talk, I don't know, maybe they do this in every industry, but in healthcare especially, every time they talk about some kind of reform, some kind of new business model, people are looking for the one way. Healthcare is about everybody. It's not something that people only interested in golf do. You know, like in the golf industry, by definition, your people are golf aficionados. Healthcare is for everybody, all different classes, all different ways of interacting. That means that there will be no ideal system. There's some pretty good systems. Mayo's great. I'm a fan of Kaiser. There's some pretty good systems at doing things on a large scale for a lot of people. There's never going to be one way to do it. And this is one of the opportunities in digital healthcare, because digital healthcare can help connect people together in different ways that can be different for different business models. So no, I don't think there is an iconic, and I don't think there can be, or should be. Should be lots of different tools.
Fair enough. Any questions from anybody in the audience?
Just give me three minutes at the end of this.
Can you hear me? Good. I liked your comment about 5% or doing 50% of the costs. And I think I also heard you say that's where we should focus. My questions and observations are, though, that while some of that 5% is the same, the predictive models have shown that actually it turns over. And that wouldn't we be better off focusing the kind of connected health you're talking about with a more general population? Go after pre-diabetes, even though they're
Yes.
harder to identify.
In order to
and
keep
just the
them,
5%?
in order to keep them out of the 5%, in order to, the least expensive 50% of healthcare spends 3% of the money. Well, what we don't want them to do is to move into the 5% that spends huge amounts of money. So yeah, we want to focus on people before they turn into big cases. Healthcare's always been interested in the big cases because guess what? You pay us to do that. But now we're going to be paying healthcare to keep people from becoming big cases.
So a lot of people are afraid of Apple, Samsung, LG, all the big boys coming in there. But I think instead of being afraid of them, one of the biggest problems was the connectivity of the platform. Apple is the only one who seems to be forcing Epic to open up the EMR. And so I think a lot of the people should look this as an opportunity because Apple is going to stay in the consumer electronics healthy population there. The opportunity is using these platforms to use this for chronic disease. So can you, expand on that?
So Apple is forcing Epic to open up the EMR. That's very interesting. That's very interesting news. And I've predicted this for some time, that when we find really disruptive innovation, it's not going to be from legacy players like Epic, because Epic is just trying to figure out how they can make the most money from the current model. It's going to be from people from outside of healthcare coming in and busting the doors off, people who have enough economic power to do that. And Apple is a perfect example of that. I hope they are able to do that. Yes. Yes, ma'am.
Hi, I was just going back to your ideas around the delivery, the trusted group,
Yes.
and then the team approach that we learn over time. I'm curious your thoughts about the crowd, the others like me, in like right now we're seeing the social function, and how does that come into that idea, if at all? And how do
Say that you're interested in the
about the delivery and how we're
like crowdsourced information on healthcare.
And I'm going back to
Yes.
your ideas around trusted sources.
Yeah.
And sort of these teams that are learning over time.
Yes.
And I see that as the crowd and the sort of others like me. That seems to be
Yes.
for a lot.
That's very important. This is an important development over time. The information about health has evolved into groups online like patientslikeme.com and others like that have millions of people interacting around their particular problem. And it's especially for those kinds of problems that are not really that well addressed by the medical community. There's not a cut and dried, here's how you deal with it, because they can often find out more from each other and from clinicians that become part of these groups online. They can find out much more about their condition and how to deal with it than they can from your average clinician or from the medical system per se. This is a very important development, and they do trust each other in these communities. That is a good example of a digital trusted connection. So I'm not sure how, I can't come up right now with how an app or a dongle or a gadget of some kind would help people interact with those communities, but I would think that would be a ripe place to mine.
One last question.
One last question.
Hi. You made a distinction between the fitness
Yeah.
devices and the medical devices. And I'm wondering how you see the future. Do you see it as people having just the fitness device and then maybe 8 different medical approved devices, or that it's going to be one device that will track your fitness and your performance and also be regulated and approved?
It'll be the same way that how many of us have only one word processing device on our tablet? You know, how many of us have only one way of tracking our health? You know, we just download all kinds of apps and use them as are appropriate to our time of life, our responsibilities, and our interactions with the clinical system. So we will use all of them differently over time in a very flexible manner, and with who we are. How educated are we? How willing are we to take the judgment for ourselves? So it's not going to be one model. It's going to be a wild, kind of semi-chaotic ecology. But let me finish with this. I don't know about you. Maybe I seem a little fierce for 9:30 in the morning, but I am fierce about healthcare. Millions of people's lives suffering, good health, agony depends on it. We are not given in this world many opportunities to actually make a difference. They're not asking us whether to invade Iraq right now. They don't ask us what to do about poverty in India. Here is the place where we can actually make a difference, is in helping healthcare, which is in this moment of enormous turmoil and is desperate for answers, helping them find the way forward to providing healthcare that is better and cheaper and available to everyone in the system we have. We have this opportunity, and I challenge you to take it on. Thank you very much.
Perfect.